In 2022, the Ministry of Manpower introduced a primary healthcare system for migrant workers. Funded by their employers, the primary care plan entitles workers to basic medical services for acute and chronic conditions with a co-payment of $5 per visit before GST.
I think the primary care plan for the migrant workers is one of the best things that has happened for our migrant workers. It has increased the affordability and access for the migrant workers to get primary care. They have a large panel of clinics they can visit island-wide near to their workplace, their residence. Most importantly is that the co-payment fees of $5 for a face-to-face consultation is very affordable in the perspective of the migrant workers. Prior to the primary care plan, the workers would probably have to fork out $50 to $100 out of pocket, right, to see a doctor, either at the polyclinic or the GPs.
I feel like faster service and then good management. So all doctor and staff very nice, very kind. So I also got faster service. Like I have a urgent case, so they make also faster, different with others, another medical center.
I booked the appointment in this morning, and then the transport is coming exactly 1:30 and pick up me and bring me here in this clinic. Transport also on time.
However, local charity HealthServe say many migrant workers remain unaware of their basic medical entitlements.
9 out of the 10 patients who come to visit us here at HealthServe are not aware that they are entitled to the primary care plan. So our team members, of course, will share with them what they are entitled to. But we also take care of the workers, and thereafter encourage them to see their PCP clinic near their workplace or residence. So as part of our program, we actually also onboard a group of migrant workers, volunteers, who are passionate about giving back to their communities in terms of medical health awareness. They educate their peers basic symptoms of chronic diseases and also how to live a healthier lifestyle. They also share about their entitlements for the primary care plans and where to seek help if they do have the symptoms.
Despite the general success of the PCP, Dr. Kwan sees some gaps within the healthcare system for migrant workers such as dental care, outpatient specialist care, and mental health care.
So dental care is a great need that is not covered by the primary care plan. We all know that unsubsidized dental treatments can be quite expensive. This takes up a large fraction of our migrant workers' monthly salary. We found that 1.5% of the workers in the CMP sector actually suffer from acute dental pain that requires early dental treatment in the immediate 4 to 6 weeks. Specialist outpatient care is also an area not covered by the primary care plan, or in fact not covered by any of the insurance plans for the workers. All this will be out of pocket by both the employers or the workers. We have a recent case where the worker had to seek help with us because he had some enlarged lymph nodes, right? And this could be due to many causes. Of course, the most serious of them would be cancer. We worked with the worker to engage the employer, but the company was unwilling to support his care. So we worked with the worker to undergo further diagnosis. Thankfully, it was something very treatable. But because of that, I think it highlights the need where some form of insurance plan would be helpful to help both employers and workers to provide for this gap area. Mental health remains an area where more awareness and education can be done, right? Not much is spoken about it, but really it's a silent killer, right? Workers who suffer from mental distress, whether it's anxiety or depression, may get distracted at work and therefore result in safety lapses. These workers will benefit from early detection and early referral for care.